Thank you, Mr. Chairman. Thank you, Madam Secretary, for being here. You said in your opening statement that there would be no deficit financing as a result of this health care reform package if it became law. Is that literally true?
Mr. Chairman, I was quoting the President. The President has said consistently that he will not sign a bill unless it's paid for.
So we just want to establish on the record right off the bat that there'll be no increase in the deficit as a result of a comprehensive health care package if it does become law. That's just, I mean, plain language.
That's what the President has stated as one of his top priorities. It will be paid for within the period.
Let me walk through just one part of your program. It creates a new category of coverage under Medicaid at 133% of poverty, which will be 100% paid for by the federal government, no state match, for childless adults between the ages of 19 and 64. This one provision, if I understand it correctly, could add as many as 20 million Americans to the Medicaid program. Now, I don't know what the cost number is for coverage per person under Medicaid, so I just picked a number. And if my number's wrong, correct me. But I said $6,000 a year for insurance. That may be too high. But if you cover 20 million people at $6,000 per year, that's $120 billion right there per year. How do you pay for that? What are some of your pay-fors? Because in the bill, they're to be determined later. So give me an example of a pay-for that's $120 billion a year.
Congressman Barton, the President has proposed about $660 billion in savings from the current Medicare and Medicaid program. In addition, he has proposed revenue enhancers of about...
Well, that's over a 10-year period.
Yes, sir, and I think your figure is...
Per year, $120 billion per year.
Well, I would start with the premise that, first of all, I don't know the numbers accurately, and I assume that your 20 million is within the ballpark. I just can tell you that whatever the proposal that comes forward, the President has insisted that the bill will be paid for. The measures that are proposed will be paid for.
You're a former governor, I believe. Isn't that correct?
Yes, sir.
I believe of
Two-term.
Kansas. Is that
Kansas is the state.
Governor of
yes,
Kansas. Does Kansas have a balanced budget requirement for its state budget?
Yes, sir.
It does. Okay. When you were governor of Kansas, by law, you had to submit pay-fors when you submitted a budget that spent money. Isn't that correct?
Well, we spent money within the revenues we had.
Yes, ma'am. Now, again, my numbers may not be the number, but they are definitely in the ballpark. If I give the President the benefit of the doubt that there are out there $600 billion over 10 years in savings, $60 billion a year, this one expansion in Medicaid is still $60 billion a year short. You're the Secretary of Health and Human Services. I assume you have had some interaction with Chairman Waxman and Chairman Rangel, Chairman Miller, in providing this draft bill. You have to have some idea of how you're going to pay for it. And again, I'm giving you the benefit. If the President says he can save $60 billion a year, I'll stipulate for purposes of this hearing, save 60. But I think you need to put $60 more billion in savings or in tax increases on the table.
Well, Mr. Barton,
you had to do it when you were governor.
That's true, sir. And this is a discussion draft. What I can assure you is, at the end of the day, the bill that passes will be paid for. We will work closely with the chairman here in the House and the senators on the other side to come up with strategies to do just that.
Well, shouldn't we tell them up front?
We don't have a CBO score yet for this bill, nor a score for the various proposals that are in this bill.
But at least you've got to put on the table where you're going to get the money.
I understand.
It's not a box of chocolates. You don't know what you're going to get. You just pull it out. Oh, there's $60 billion, whatever. Well, Mr. Chairman, my time has expired, but I think we've established a basic point. I mean, it's a good thing if you're going to have no deficit financing. I commend the President for that. But it's a bad thing if you don't shoot straight with the American people where you're going to get the money. And nobody says that we're going to be able to save money to pay for these huge expansions, totally by savings, pay for these huge expansions. I just pointed out one part of the bill, and already we're at least, in my numbers, $60 billion per year short. Thank you, Mr. Chairman.